Come in.
Hi, I'm Ashley. I'm going to be your nurse
Nice
today.
to meet you.
Can you tell me your full name and date of birth?
Lacey Leanne Lamb, April 27th, 1986.
Okay, you're alert and orientated ×3.
Yes.
Yes, okay. So what brings you in today?
I just need a general checkup. This is my first time in the office.
Okay, sounds good. Well, I'm just going to go through and ask you a few questions, and then we'll get started on the head-to-toe assessment. All right?
Mm-hmm.
Okay. So is there anything about your family history that is concerning or that I would need to know?
We have a lot of cancers that run on my mom and dad's side. A lot of like female cancers, lung cancer, no other real health issues on either side.
Either
now.
side, okay. No heart issues or anything?
No heart issues that I can think of.
Think
now.
of, okay. How is your nutritional status? Do you eat, how many meals a day do you eat? Do you snack a lot?
Sometimes I skip breakfast because I drink a lot of coffee in the morning.
Okay.
I try and get in as much water as I can on a daily basis.
Okay.
I do drink a lot of diet soda.
Okay.
And my meals are pretty well balanced unless I'm on the go.
Okay.
And then I just grab whatever.
But typically good 3 meals a day, and
Yeah,
you try
for the
and
most
get in
part.
all your water that you need?
I try to.
Okay.
Yeah, some days are better than others.
Okay, good. Well, I am just going to get a set of vitals here, and then we will get started.
Okay.
That arm is 132/76.
Okay.
So pretty good.
It's about normal.
Yes. And 138/60. Okay, so I'm just gonna get your pulse in your wrist here. Okay, and that is 76.
Okay.
Okay, and I'm just gonna watch your respirations, okay? Okay, you're about 18, so that is normal.
Okay.
Okay. Now I'm just gonna get your temperature, okay? Just gonna open your mouth and put it under your tongue. Okay, 98.6. Okay, now I'm just going to take a look at your skin on your face, and then we will start inspecting your hair, and we will work down the body, okay?
Okay.
Alrighty. Your skin is nice and warm and intact. Okay. Just going to feel in your head here. No lesions, or do you have any tenderness?
No.
No. Okay.
But you could do that all day. I could fall asleep.
Okay, and now I'm just going to feel around your head, okay? And I'm going to feel your sinuses. Does that hurt, or do you have any pressure?
Nope. I can just feel your
Oh,
hands there.
okay. Okay, and I'm going to palpate your carotid on both sides. Okay, good. I'm going to get my pen light, and I'm just going to, if you can look at me, and I'm going to shine the light in your eye.
Okay.
Okay. Okay. Good. And can you open your mouth for me and say ah? Good. Mucous membranes are moist. Good. Okay. Now we're gonna assess your eyes again. Can you read this line for me here?
874.
Okay, great. And how about this one? Just the first three.
Sure. 638.
Okay, perfect. And then can you read the lowest line possible that you can read?
374258. I think it's the third one up.
Good, perfect. Okay. Now I'm just going to take a look in your mouth again, and then we're going to look in your ears, all right?
Okay.
Okay. Can you open your mouth again for me? Okay. Your teeth all look good and intact. Can you lift your tongue to the roof of your mouth for me?
Mm-hmm.
It's okay. All right.
Sorry.
Nope, you're fine. Okay, now I'm just going to move your hair back. I'm going to take a look in your ears. Okay, I'm going to pull them up and back, and then I will take a look. Okay, that one looks good. No redness or drainage, so
Okay.
that's good. I'm going to take a look at the other one. Are you having any pain or?
No, sometimes I get a little pressure because I spend a lot of time in the pool.
Oh, okay.
But other than that, no.
Okay. They look good.
Okay.
I'm just going to assess your ability for sensation, okay? So I'm going to rub this cotton tip, put it in different places on your face, and just tell me if it's a dull or a sharp pain, okay?
Sure.
Alrighty.
Just dull.
Okay. And then how about this one?
Just a little prick.
Prick, okay. And this?
Yep, just dull.
And that?
Prick.
Okay, good. Okay, and then we like to assess your pain on a scale of 0 to 10. Are you having any pain right now?
No, not at
No.
all.
Okay, so if you were, we would just use this scale and have you say, you know, on a 0 to 10 what you are feeling right now, and then we would go from there, okay?
Okay.
Now I'm just going to have you close your eyes, and I'm going to have you smell a few things, and if you could tell me what you smell, all right?
Okay, sure.
Okay. Can you tell me what that smells like?
Alcohol bath.
Okay. Sorry about that.
No, that's okay. That's all right.
And how about this?
Coffee.
Okay, perfect. You can open your eyes now. I'm just gonna put a little hand sanitizer on now, okay? Okay, now unfortunately I have to test your gag reflex,
Okay.
so it might be a little uncomfortable,
Okay.
but I'm just gonna have you open your mouth. I'm gonna push your tongue down as far as I can, okay?
Okay.
Alright, you open your mouth. Okay, perfect.
Just the taste of that wooden tongue depressor
I
can
know,
make you want to gag
yes.
sometimes.
Not comfortable at all. Okay, I'm just gonna write down my findings.
Okay.
Okay, and then I'm just gonna look in your eyes here at your sclera. They look white and perfect, okay? And I'm gonna just pull down right here and look at your conjunctiva, okay? Alrighty, those look good, okay? Okay, and then can you smile for me? Okay, can you pucker up your lips? Okay, perfect. And how about raising your eyebrows? Good. Okay, I'm just gonna feel around on your nose again. Okay, it's all symmetrical. Do you have any drainage that you are aware of?
No, I don't have any right now. Sometimes
Okay.
in the spring, like this time of year, I can have a little bit of allergies, but right now I'm not having any problems.
Okay, good. That sounds good. Alright, so now I'm just going to move down and I'm going to take a listen to your heart and to your lungs, okay? you lift your arm up for me? I'm just going to listen under here. Good. Nice deep breaths. I'm going to go over to this side. Now I'm just going to go posterior, okay, and listen in the back. You could just lean forward a little for me and take some nice deep breaths. Good. Again. And again. And let's do one more time. Okay, perfect. All your heart sounds and lung sounds sound good. You don't notice any like skipping heartbeat or anything like that?
No, I just in the last couple of years have started working out a lot, and I'll sometimes get like a little palpitation, but nothing major. And when I was growing up, I had some like sports-induced asthma, but I've pretty much grown out of that.
Yeah, your lungs sound clear and no adventitious sounds or anything, so good. Alrighty, I'm just going to take a look at your skin on your arms, okay? So, good. Okay, your skin turgor is good. I'm going to look at your capillary refill. Okay, that looks good. Less than 3 seconds. Good, we'll take a look at this one. Good. Okay, perfect. Okay, so now I'm going to take a look at your abdomen and listen to your bowel sounds, okay? And is there any previous surgeries that I should know about or pregnancies?
When I was in 5th grade, I had a small surgery just to remove a piece of wood from my hand.
Oh, okay.
And then I had a C-section. I had a daughter that was Frank breech, so she was butt first.
Oh.
So I had a C-section in 2008.
Okay. And that's your only pregnancy and viable birth?
Yep.
Okay.
Yep.
Sounds good. Alrighty. Now I'm just going to take a listen to your abdomen and your bowel sounds, and then I'll just kind of palpate around a little, okay? Okay, good. I did hear bowel sounds in all 4 quadrants. If we wouldn't have, we would have had to listen for about 5 minutes in each quadrant just to make sure that there were no absence of sounds, okay? So that was perfect.
I dropped something over here. I'm just gonna pick it up.
gonna take a feel, alrighty? Does that hurt at all?
No, I don't really have, I have a little bit of pain where like the scar is a little bit
Okay,
sometimes,
every
like
now
where
and
my
then.
jeans hit, but nothing
Okay,
really to
good.
report about.
Okay, good. Okay. And then do you have any allergies that you know of? Any food allergies or medication allergies?
Keflex and Augmentin just don't agree with me.
Okay.
I've never had like an anaphylactic type reaction, but it just causes me some nausea and vomiting.
Okay.
I am allergic to nickel and a lot
Oh.
of contact type of dermatitis,
Okay.
but mostly just seasonal things. And those 2 antibiotics is all I
Okay.
can think of right now.
Alrighty. Okay, I'm just gonna work my way down your leg.
Okay.
I would normally check your femoral pulses, but for the purpose of this video, I'm just gonna keep on moving down.
Okay.
Okay, so I'm just gonna take a look at your ankles and your feet. Do you ever notice any swelling or?
Sometimes when I've
Edema?
taken in a lot of sodium
Okay.
or drinking, my feet and ankles will swell a little bit,
Okay.
nothing major.
Okay.
When I was pregnant, I had obviously
Yes.
a ton of pitting edema.
Oh, yes.
But nothing that's I can't, account for. It's usually something I've done that
Okay.
causes a little bit, or in a little bit in my hands.
Okay, sounds good. I'm gonna try and feel your popliteal pulse, okay? Okay, and your skin trigger looks good on your feet. I'll take a listen to the pulse on the top. Okay. And your capillary refill on your feet is less than 3. I'm just going to take a look at the other one and make sure it's all the same. Okay, good. And you don't have any swelling or anything to be noted of right now. Now I know you did just sit down, but I'm going to have you get up. And I'm going to move the chair. Yes, perfect. Okay. Can you walk towards me?
Yep.
Okay. Perfect. Okay, and then turn around and walk back to the wall. Good. Okay. And then walk back towards me, and I'm going to have you turn around. And if you could bend over and try and touch your toes, I'm just going to feel your spine here.
Okay.
Okay, perfect. And stand up. Okay, and you don't ever notice any, you can turn back towards me, any curvature of your spine or?
No.
No, okay, yep, it's all in line and good.
Okay.
So I'm going to make note of that. Okay. And then can you just kind of shrug your shoulders for me? Okay, good. And then can you turn your head to the side and to the other side? Good. And how about touch your chin to your neck and then all the way back? Okay, perfect. And then I'm just going to put my hands right here, and can you kind of shrug your shoulders against resistance? Okay, perfect. And then can I see your hands? Can you squeeze them? Good, okay. And then can you go like this? We're going to check, does that have any pain or anything? No? Okay, and then can I hold your hands again? Okay. Can you push against mine? Perfect. Okay, good. All right, and then can you just take your finger to your nose on both sides? Good. Okay. And then can you close your eyes and just try and balance? Okay, perfect. And then how about lift up one foot and stand on one? Good. That's all right. And then how about the other one? Good, okay. Alrighty, I'm just going to bring the chair back over and have you take a seat again. Just going to document some of my findings here. It looks like your gait is good. You don't have any, do you ever have any dizziness or anything?
Sometimes, like I said, I am in the pool a lot. If I get a little like water in my ear, sometimes I think I'll feel a little bit off balance, but nothing I can't really attribute to just being in the pool.
Okay, good.
I do take some daily medications sometimes
can... So what are those medications so we can make sure to write those
So
down?
I have Xanax PRN.
Okay.
And sometimes I feel like if I've taken one before bed, sometimes in the morning I can feel a little, when you asked about my balance,
yes.
I don't feel off balance, but sometimes I'm a little groggy in the morning after I've taken one.
Taken it, okay.
Yeah. I take oral birth control pill.
Oral, okay.
And I've been on that since the birth of my daughter in 2000. Well, it'd be like 2009 when I went on that.
Okay.
I take a probiotic daily.
Okay, good.
Just once a day.
Okay.
And
how about a multivitamin or anything?
I don't take a vitamin.
No vitamin.
And I just take, if I have like any lower back pain or anything like that, I'll just take like Advil.
Okay, Advil.
That's usually what I take. But probably not even in the last 3 days. I wouldn't say I've had any of that.
Okay, good. Okay, well I believe that concludes our head to toe assessment. Are there any questions that you have for me at this moment?
No, I don't think so.
No? Okay, well I am just going to document all these findings and I'm going to let the doctor know, and then we will kind of go from there and the doctor will be in to talk to you. I don't notice any abnormalities at the moment. Again, the doctor will come in and kind of go through his little assessment as well. But right now, everything looks good. And I will make note of your medications that you are taking and everything like that. So thank you very much, Lacey.
Thank you.
All right,
Have a good
have a good
day.
day. Thanks.